Hello, good afternoon. Dr. Trudy Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our Saturday Open Clinic. Today's topic will be on SGHS PPP method of achieving pregnancy. So when you join, let's quickly talk about the components of SGHS PPP method of achieving pregnancy. And I'm just going to start. Once you come in, you just join me. After my presentation, I'm going to take a couple of questions. Now, pregnancy is a well-structured process. Pregnancy from day one, from childbirth, was already structured to happen. Our duty is to fit into the narrative which God has already set. So the way the female reproductive system is structured, a man will find a woman. Both of them will fall in love. Both of them will decide to start their family. By the time they've decided, God has already equipped the woman with everything she needs to start her family. So a woman is given the vagina, a woman is given the cervix, a woman is given the womb, a woman is given the tube, a woman is given the ovaries. These are the components that will help you to conceive and carry your baby up to 9 months, which corresponds to 42 weeks. Now, when you are trying to start your family, you need to understand the steps. You need to understand what's required of you in order to achieve this big objective. For some reasons, previously, it used to be very easy to become pregnant. That's why our mothers, our grandmothers, our foremothers all had so many kids, because it was very easy for them to become pregnant. But for some reasons, for some defined issues, environmental factors, becoming pregnant lately is becoming difficult. So we need to devise the means to understand what's required of us. So in our organization, Snowspirations Global Health Solutions, we devised a workable plan. It works 24 hours. And it's called PPP method of conceiving a baby and carrying the baby up to 10. The first P is recognizing the power that be, which is God. So we pray a lot. Now, the type of prayer you will say if you're believing God for a baby is entirely different from your generic prayer. Your prayer is communion with God, reminding God, speaking into your future, calling forth your babies. Forceful, petition-based prayer. So we pray a lot, 24 hours. So the very first component of the PPP method is what? Praying. So the first P is praying. When you wake up in the morning, if God still give you the opportunity to be around as a woman, you have to go down on your knees. You have to thank God for life. Because if God woke you up because God has a purpose for you. If God still doesn't want you to become a mother, you won't be around. So if you woke up today and you're hearing my voice and you're still not able to get that positive pregnancy test, it's okay. God has a purpose for you. God woke you up today. God gave you life, that despite all the odds, you are standing. So you need to connect with God. You need to connect with the essence of making you a woman, because when God gave you your vagina, he didn't make a mistake. When God gave you the cervix, he didn't make a mistake. When God gave you your womb, every part of your body is to build you up to that moment of becoming a mother. So it's not a question of, asking God if. You're becoming a mother is not if, it's when. Because it's already there. So we pray a lot in our group. Prayer is what we just do. But please be mindful of the type of prayer you're praying. Some people pray a defeatist kind of prayer. You're just generically just wishing and hoping. We don't do that. We already would know we're going to become mothers. We are just going through challenges. So when we pray as if we are talking to our Father, because he's our Father. When you go to your father's house, you don't need visa. You don't need maid. You walk straight to your father respectfully. You begin to demand anything you want to demand from your father. If you're hungry, you go to the table and you begin to eat with your father. You don't eat crumbs. This is exactly how you talk to God. You don't need an ambassador to talk to God on your behalf. No. You have direct access to your father. So you don't need a special pastor. You don't need a special place. You don't need a special group. You don't need a special church, mosque, or someone that will now come to be the ambassador to talk to God. No, you don't need all those things. You have a direct entry to God. You talk to God. There are some days you get pissed off. There are some days you talk madly. There are some days you cry. There are some days you weep. There are some days you tell him, you know what, but you promise me. There are some days you say, I will never let you go unless you bless me. They are all prayers. But you have to have seen your babies before they are here. So you have to activate your faith, because without faith, it's practically impossible to be a mother. So that's number one. Number two, the second P, so many people are not doing it. And this is the most important practical P. You have to make love 48 hourly. Now, this is regardless of your age, number one, regardless of your readiness, regardless of your mood. If you understand your why, if you understand your assignment, if you understand your mission, then you have to make it a point of duty to diligently and persistently and with perseverance keep showing up. Keep showing up every 48 hours. Keep showing up. Keep showing up. Come rain, come shine. It doesn't matter. You keep showing up. Do you know why it's important you show up 48 hours? Because as I explained, for some reasons, things are not the way they used to be. Things have changed. Previously, women looked for contraceptives to stop having so many kids. Lately, even young women are having issues. Even women that haven't even had any issues growing up are having problems. Even young women are having problems. Women that ordinarily should have very high fecundity, very high fertility, are having problems. So the question is, what are we going to do? So if you understand the component of the second P, if you understand the mechanism that leads to pregnancy. So what's the mechanism that leads to pregnancy? You need to look at the egg differently. You need to look at the sperm differently. The egg and sperm are not the same thing. The sperm is a very flamboyant, carefree cell when it comes to making babies. When a man ejaculates, there are millions of sperm, multi-millions of sperm. So this is a picture of the sperm, this one, multi-millions, okay? Now, besides the fact that sperm are a lot, they can survive up to 5 days. Some can survive up to 7 days inside the vagina. So a man has a lot of potentials. A man has a lot of abilities. A man has a lot of chances to create that avenue to get the woman pregnant. But the egg is an entirely different ball game. When you were born, a girl, you came into this world with all the eggs you will use to start your family. Unfortunately, as you're getting older, you will be losing them. Some will die by themselves. Some you will be releasing every month. They will not be fertilized and they will keep dying. So the older you are, the more you're depleting the eggs that God already gave you. So that when you come to age 35, you have very few quality eggs remaining. Now, despite that, when you release that egg, you have 24 hours for the egg to be fertilized. Whereas the sperm needs 5 days. So can you see the difference? The difference is like night and day. So becoming pregnant is a calculated effort of persistence. Now, this is where women get it wrong. Some women might have signs like they are ovulating. Some women might think they know their cycle. Some women might think they have a regular 28-day cycle. So say they will begin to wait for their partner on day 14 based on the normal scientific teaching that if you have a 28-day cycle on day 14, you will ovulate. So some women now diligently come and wait for their partner on day 14, hoping that that's the day the egg will be released. But guess what? Stress can alter your cycle. Your mood can alter your cycle. Adding body weight can alter your cycle. Lack of sleep can alter your cycle. Hormonal issues can alter your cycle. anything that happens to you as a woman can alter your cycle. So you might be 28 days, then suddenly you're 35, or you might be 21, or you might be 25. So you're all over the place. So we cannot pinpoint when you will exactly ovulate. So we don't take chances. So because the egg lasts for 24 hours, we have to be doubly sure that once the egg is released, the sperm can go in and arrest the egg. This is why we preach regular, unprotected sexual intercourse with your partner 48 hourly. Why do we preach 48 hourly? Because we want to have adequate sperm in the vagina, in the cervix, in the womb, getting ready so that anytime the egg is released, the sperm can go there and fertilize the egg. And this will tell you how God works. God works in mysterious way, in minor details, because out of those millions of sperm that will be released, only one out of million will fertilize the egg. Once that one is fertilizing the egg, the rest of the sperm will be wasted. So think about that for a moment. One egg, millions of wasted sperm. So let's use an example. You're a woman. You're ovulating, confirmed. Then you ovulated by 12 a.m. when you were sleeping. And you just want to practice the ovulation method. Now, if you ovulated by 12 a.m., by 6 a.m. in the morning, you've had six hours gap lost. If you guys are the type that make love early in the morning, you can quickly buy into that window, right? But if you guys probably made love before the 12, you still have a chance, right? So which is what we're preaching. But if you release your egg by 12 a.m., and your partner is waiting for triumphant entry on the following day, maybe he might come back, he might be so tired, so he might even miss that window. Guess what happens? By 12 a.m. the following day, the eggs will no longer be viable because they've completed the 24 hours. And you have one chance to become pregnant every cycle, which coincides to every month. So if you miss that, you start all over again. But if you have adequate sperm prior to and afterwards, that adequate sperm inside your vagina can still get you pregnant up to 5 days after you made love. These are practical things. Becoming pregnant is not a passive process. It's an active process. You have to work out your salvation. You have to act as if your life depends on it. You have to be fully knowledgeable. You have to place yourself in the arena of blessing. So all the women that became pregnant in this group were correctly praying. They were correctly making love. Now the third P is practice. The third P is being a member of this group, listening to everything I'm telling you, heeding to my advice, eating properly, sleeping, watching your body weight, taking your prenatal multivitamins, but importantly, having a fertility specialist. So these are the three components of SGHS PPP method, and it works. Since 2015, we have liberated thousands of women who prior to now never knew they will become pregnant. Now they are easily becoming pregnant simply by practicing PPP, simply by praying to God, simply by making love around the corner. Sometimes you even make love when you are bleeding and you can become pregnant. So it's all about your orientation. Some women are focusing on the wrong things. Some women are focusing on the cervical egg makers. Some women are focusing on the fact that they are no longer bleeding. You can still become pregnant when you are not bleeding, because so long as you're ovulating, you can become pregnant. So don't lean on your understanding. Then at the end of all this, when you are doing your best and your best is not good enough, what do? You need a specialist. This is why you need a fertility specialist. A fertility specialist is a doctor that went to medical school, trained as a general doctor, then trained as a gynecologist, then beyond being a gynecologist, trained as someone that is only interested in helping couples that have infertility. And that's the person you need. So for every member of this community who is currently having problems. So what's the definition of having problems having a baby? It has to do with age. So I'm going to give you two definitions. If you are 35 years below and you and your partner are living together, the problem is so many partners are not living together. So many partners might be in the same house but they have different rooms. That's not the good practice. If you are living in the same room and you guys are making love 48 hourly and you are below 35, and after 12 months, if you don't have a positive pregnancy test, you have infertility. If you are 35 years and above and you guys are praying, practicing, and doing the right things, after 6 months, no pregnancy test, you have infertility. So don't jump the gun. Don't go ahead on time. Don't marry by December, then by January, you've already started freaking out. Stress on itself, anxiety on itself, depression on itself can stop you from becoming pregnant. So you need to be diligent. You need to be proactive. You need to be forceful. You need to be persistent. The fact you didn't get pregnancy test positive is not the end of the story. Failing is part of success. But when you call yourself a failure, it means that you failed the test and you refuse to try again. The fact you didn't get positive pregnancy test in January doesn't mean you won't try in February, doesn't mean you won't try in March. You continue trying until you become. Because even in a normal couple, on a normal day, there are probabilities. Even when everything is perfect, you don't just become pregnant by magic. There are certain times everything will be perfect and you won't be pregnant. Then there are certain things might not be perfect and you become pregnant. This is the God factor. So these are the steps you have to take. We don't beat about the bush. You are not here to go and be trying and, the problem is we try this, it doesn't work, we come back. There are some people that have been trying for 10 years. You've tried herbs, you've tried clomid, you've gone here, you've gone there, and you're wasting the time you don't have. And the problem can be something we can fix. There are so many people that are not making love. All you need to do is to go back home and make love. You go easy, you sleep, you eat good food so that your body can function exactly how God purposed it to function. Because you are a mother by default. You have a temporal delay, but you will get there. It's not the end of the road. Okay? So that's my presentation. Very simple, straightforward. I'm going to allow us to start asking our questions. So please feel free to ask me questions. Probably in the next 10 minutes, I'll provide you feedbacks. Then we're going to discuss for the weekend. Now, remember, this is the last week to enroll in Super Masterclass, specially meant for advanced in maternal age. So when you get to age 35, you are classified as a special lady. You are advanced in maternal age. You might likely have delays in becoming pregnant. And you need help, you need knowledge, you need change of attitude, you need change of perception. So we have a special event on the 29th. That's next Sunday. You don't want to miss this for anything. It's exclusively for people that want to beat the odds of becoming pregnant. Now, tomorrow in our group, we have a special guest. A story you don't want to miss. A story that will wake you up. A story that will remind you who you are. So this beautiful couple are going to be featured tomorrow. They've been together since 2015. They've had their failures. They had so many failed attempts naturally, went for assisted reproductive technique, failed IUI, failed IVF, but they kept going. As at last year, January last year, when I met the guy and I met the wife, I didn't even know they were having challenges. They were just jovial. The guy was doing his MC job. The woman was decorating the venue for the wedding. They were just doing their thing. I didn't even know. The woman came to me and said, "Hey, Doc, I'm in your group. I follow you. Thank you so much. Let's take pictures and all that." We continued. But I didn't know they were going through their stuff. But guess what? God answered their prayers when they went one more time. So there is power in going one more time. They went for another one more time trial. Guess what happened? God didn't give them one baby. God didn't give them two babies. Not even three. Matter of fact, when they went for their first scan, sometimes we see one or few things and we say, maybe that's another sack. But the last scan, which a woman is supposed to go for, which is the anomaly scan, basic scan, they actually discovered that it might be 3 babies. But guess what? When it was time to deliver the baby, they discovered they were having 4 babies. And they have 4 babies. So as of today, a family that had no baby in 2015, and they are young people, they continue. They have 4 babies, 4 hefty, healthy babies, 3 girls and 1 boy. We'll meet them tomorrow. They will tell us their story. So if you are on the verge of giving up, if you think it's all over, you're kidding me. You don't even know what God is preparing for you. So don't you ever give up. And I'm telling you this in all sincerity. Since I started on this journey, I have seen God move in so many ways that nobody can explain. Okay? All right. Please ask your questions quickly so I can provide you feedbacks. Go ahead and ask your question. How can you advise a husband with low sperm count to adhere to medication given to him by a gynecologist? Now, my sister, this is what I will tell you. It takes maturity. It takes persistence. It takes understanding for a man to understand that the driver in making the family is him. You don't need any other special scientific rocket scientist to come and put application to tell him, hey, do this. No, he should be a man. It's the duty of a man to be the leader when things are going wrong. When you took your marriage vow, when you took your relationship vow, they never told you it's going to be bed of roses. No, anytime you experience only bed of roses, prepare for something bigger coming, because in life, you're going to go down some days, then you're going to go up. That's called life. So I don't need to go and tell him, hey, I baby him. No, he should know better. He should understand the reason why they're trying to help him. And let me tell you the truth. You see that drug they might be giving him for low sperm count is even a supplement. The major thing that will contribute to improve quality in your sperm is lifestyle modification, not those supplements. So he needs to know this. He needs to understand and change within and decide to be the man. So many men are very complacent. So many men don't know what they need to do. They are heaping all the blames on women without knowing that the problem is coming from them. It's actually the man that will determine if you're going to have a baby. It's the sperm that will determine. It's the sperm that will carry the X, carry the Y. If the father gives you Y, you have a boy. If the father gives you X, you have a girl. It's the man. So you are not supposed to go and borrow the choir to come and preach to him. No, he should know better. You can share this video with him and you tell him to wake up. We don't have time to be begging anybody. No. He should do better. And besides whatever drug they gave him, he should think about modifying his lifestyle. Eat right, exercise, drink water, avoid alcohol, sleep. Watch your body weight, and you will blink and you become. Remember, for you to get your woman pregnant, we need to have 3 factors about the sperm. The amount, the motility, the sperm must be forward swimming, and also the morphology. How many of them are good looking? That's what will get you pregnant, okay? All right, let's continue, guys. All right, does a man need yearly well checkup? Why not? Every singular person in the family needs to go for wellness check at least once a year. So you take your kids in to see the pediatrician, you go for yourself as a woman, you go for yourself as a man, you make sure your father goes, you make sure your mother goes. Everybody in the family should go for at least one wellness visit every single year. When you go for wellness visit, that's when we discover some problems that might not have symptoms. When a woman goes for her yearly medical check, that's when we discover some people might have fibroid. That's when we discover they might have a couple of other things, because you're going to check you from head to toe. So the answer is yes. Unfortunately, some men, especially men in Nigeria, they believe they are so strong that they have not gone to the hospital. Not seeing a doctor doesn't make you healthy. The fact you don't have fever, you don't have headache and whatever right now, then we haven't checked your blood pressure. You can have high blood pressure, you can have diabetes, your cholesterol can be up, then we didn't know because we didn't check. So not seeing a doctor doesn't make you healthy. You should actually be seeing your doctor, so your doctor should be keeping an eye on you to make sure you're healthy. Very important, okay? All right. Okay. Good evening, sir. What drug should you take in preparation for conception? The only drug allowable by any doctor, any good doctor, to recommend to a woman that want to become pregnant is what we call prenatal multivitamins. Prenatal multivitamins. That's the only thing over the counter you can take. Any other drug you should take is dependent on your situation, is dependent on the diagnosis. So what you need to do, depending on where you live, go to a good pharmaceutical shop, tell them to give you prenatal multivitamins. When they give you the prenatal multivitamins, please read the label. Make sure it has adequate content of folic acid, which is 400 to 600 micrograms. Once you have it up to 400 to 600 micrograms, you're good to go. You start taking it immediately. Any woman that is currently making love without protection can become pregnant. So you are protecting your baby even before you become pregnant. That's the only drug you can take without prescription. Besides that, you see your doctor. You want to start trying immediately after wedding. So you're actually at a very good advantage right now. So go and buy the prenatal multivitamin. Make sure you eat properly. Make sure you're exercising. Make sure you're sleeping. By the grace of God, if you guys marry and you do this, before you blink, you become pregnant. Okay? All right. Does ovulation occur every month? Well, if you are younger than 35, the possibility that every month you ovulate is high. But if you begin to get to age 35, some women will be skipping ovulation. So some women might not be ovulating every month, but it's expected that in 12 calendar months, you are at least supposed to ovulate about 9 times. Okay? So it's not every month you ovulate. Okay? All right. Okay. Is fibroid embolization helpful for a woman that has done myomectomy before? Well, here's the deal. When you're talking about embolization, we are actually occluding the blood supply to the uterine artery that might feed the fibroid. Okay, so that's what embolization is. Blocking blood supply, because unfortunately, your fibroid depends on blood. So when you strip them of those blood, they can shrink, but that's not a permanent solution. Now, if you have had myomectomy in the past, that means they've removed your fibroid. And depending on the type of fibroid, we actually have 3 types of fibroid. We have the intramural, we have the submucosal, then we have the subserosal fibroid. Of the 3, the one that has fertility significance is the ones inside your womb, which is the intramural and the submucosal. If it's bigger than 6 cm, it's giving you symptoms, we remove it. Unfortunately, in some women, when we remove the big fibroid, over time, the little ones will grow and become big. That's what happens in women that go for myomectomy, then they go back. Now, I don't know the reason why your provider will offer embolization. Any woman that wants to start her family and you have significantly symptomatic fibroid, the best approach is to go for surgery, especially if it's inside your womb, because think about this. This is the womb where your baby will develop. So the freer and the more space they have, the better for your baby. There are some fibroids that will delay your ability to become pregnant. There are some fibroids that will lead to miscarriage. And there are some fibroids that can damage your womb up to the extent of doing hysterectomy, removing your womb, okay? So piggyback to your doctor. I don't know your medical report, so I can't really advise you much. Okay? All right. Okay. What necessary procedure is needed for adoption? Now, it's a very well-structured, stepwise process. First of all, you have to identify with the adopting agency. Depending on your country, there are some legal steps, there are some criteria, there are some documentations you will go through. Then they begin to look for the adequate and the comparable, compatible baby you can adopt. So each country has different ways of adopting. So if you're in Nigeria and you want to adopt, the best route to go for this is Women's Health Ministry, or you go through your church, or you go through your local government. There are adopting agencies, but please be careful. There are some people that trade on people's babies. If you must adopt, it must be legal. Everything must be fully legalized, because once your adoption is complete, that baby automatically is your baby legally. Okay? All right. Can a woman who has small fibroid outside the womb advised to become pregnant? If you have subserosal fibroid that's outside the womb and it's small, then it doesn't have any impact with your fertility. So you can become pregnant with that. Okay? All right. Do we have any other question? I have just 1 more minute before I go. One more question, then I go. Okay? All right. Remember to attend the event tomorrow. Attend the event tomorrow. Don't miss it for anything. You will love that event. That event is going to change your life for good. Okay. All right, guys. My time is up. Thank you for coming. My next YouTube clinic will be on Tuesday. We'll find another important topic and we continue to talk. But remember, if every other thing fails, God will never fail you. That's for sure. So continue praying, continue making love 48 hourly, then please get a fertility specialist. And if you need help, you can get help. Thank you for coming. I love you guys, and I'll see you guys on Tuesday. Until I see you, God bless you, and bye-bye for now.